Welcome everyone, and thank you for joining us today for Osteoporosis Canada's webinar, How to Manage and Administer Medications Effectively for Osteoporosis. Before we begin today's webinar, Osteoporosis Canada acknowledges the land that our offices located in Toronto are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. My name is Tracie Napoli, Director of Fund Development and MARCOM at Osteoporosis Canada, and I will be your webinar host. This webinar will provide general information. It is not intended as individualized health advice. If you have questions, please consult your healthcare provider. Osteoporosis Canada is the only national organization serving people affected by osteoporosis, working to educate, empower, and support individuals and communities on bone and muscle health and in the risk reduction and treatment of osteoporosis. We look to the best experts to inform our care guidelines for patients and care providers. Our Scientific Advisory Council is made up of experts from across the country in osteoporosis and bone metabolism and is a volunteer membership. Comprised of clinicians, researchers, and educators, the SAC advises Osteoporosis Canada's board and staff on scientific and medical issues. OC provides medically accurate information to patients, healthcare providers, and the public. Services include programs and support groups, educational webinars, podcasts, digital tools, and resources available at osteoporosis.ca, in addition to community resources. It is now my pleasure to introduce our speaker for today's webinar, Carla Purcell. Carla has been a nurse educator for medicine and surgery for more than 20 years and a nurse educator for DOME, the Dartmouth Osteoporosis Multidisciplinary Education Program, since the program began in 1998. In 2013, Carla became the first fracture liaison service nurse in Nova Scotia at Dartmouth General Hospital, and when the program expanded to other sites in the province in 2016, she became the clinical nurse educator for FLS. Carla works in partnership with Osteoporosis Canada to mentor new FLS nurses from across the country and has presented on osteoporosis and FLS at many national and provincial conferences, in addition to sitting on several national committees related to FLS. Carla is a member of the Osteoporosis Canada Scientific Advisory Council and continues to be a clinical nurse educator and clinical support for the Nova Scotia Provincial Program. In 2022, Carla completed a certificate in RN prescribing, which enhances the role of the FLS even further, allowing her to prescribe the medication for patients at high risk of fracture. It is now my pleasure to welcome Carla. Take it away, Carla.
Hi, thank you very much for that lovely introduction. I appreciate being invited to talk. I'm always happy to talk to people about osteoporosis medications. And I want to thank everybody for coming and taking the time to listen today, to learn about your bone health and to learn about osteoporosis and the medications that we give to help to prevent fractures. So what we're going to talk about today is a little bit of general principles about taking any medication. Taking medications needs to be done correctly so that they can be most effective and hopefully produce the desired action that you want them to. So we'll talk a little bit in general, and then we will take a look specifically at the osteoporosis medications, some of their side effects, and how to take them properly. As Tracie said before, remember, this is not intended at all to replace or change any recommendations from your healthcare provider. Always discuss with them any questions or concerns that you have around any of your medications. So just to get started, some general rules for taking medications. You want to talk to your healthcare provider at the very beginning about your medication history, any allergies and sensitivities. Your healthcare provider needs to know about this and any prior reactions that you may have had to medications and what they were, how they affected you, and any allergies that you might have. And not just allergies to medication, allergies in general. For example, egg allergies sometimes impact your getting vaccines. So it's important that they know all about your allergies. It's important that they know about all of your medications, including the ones that you're taking from over the counter or any natural products. Medications often interact with each other, even if they are natural products. So it's important to be able to time them correctly or only prescribe ones that aren't going to interact with each other. They need to know about any swallowing issues that you might have, because a lot of medications should never be crushed or chewed. They have to be swallowed whole. They need to know if you have any issues remembering to take your medications. We all forget sometimes, but there are some tips and tricks that your healthcare provider may be able to help you with around calendars or blister packages or organizing family or caregiver support to be able to help you to remember to take your medications. So they really need a good history around you, and they need to know you well before you get prescribed medications from them. Store your medications safely. We're not very good at this sometimes, but always they should be in the original container with the label on the container so that you know what is in that bottle before you take it. And it's important not to mix medications all in the same bottle. I can't tell you the number of times I've seen people come in with one little bottle of medications and looks just like a little candy pack. There's so many different things in it. So make sure they stay in the same bottle. Usually your pharmacy will dispense them in child-proof containers, which can sometimes be hard for people to open. So if you talk to your pharmacist, they may be able to put your meds in non-safety bottles if you're safe at home and you don't have children that might be able to get into them. Ask your pharmacist about where to store them or how to keep them appropriately. Sometimes they need to be kept in the refrigerator. Sometimes they need to not be kept in the refrigerator for sure. They usually should be kept in a cool, dry area out of reach of children. And one of the most common places that we tend to keep our medications is in the bathroom. And that's not always the best place to keep them because of the steam and differences in temperature when you have showers and such like that. You want to learn about your medication too. Any medication that you take, you're putting it into your body. So you have a responsibility to know what it's going to do and why you're taking it. So your healthcare provider is there to answer your questions. Make sure you ask them. So you want to know why you're taking it. You want to know all of the potential side effects. Any medication that you can take, doesn't matter what it is, all of them have potential undesirable effects. Make sure that you know which ones are the common ones, the best way that you can avoid the side effect. Sometimes it's about making sure you're taking the medication at the right time. Make sure you know how you're supposed to feel when you're taking the medication. You should know if it's going to make you feel better, or if it's, for example, a Tylenol should take the pain away from your headache, so you know how you're supposed to feel when you're taking them. So the response of the medication is what you're looking for. You know your blood pressure medication is working by having your blood pressure checked and making sure you're not dizzy or have a headache. So a lot of medications you can really feel them work. Some medications you can't feel work, and that's important to know too. You should also know when not to take the medication. So sometimes you can react not in the best way to the medication. So your healthcare provider should be able to tell you when to call them and when not to take the medication and how to get in touch with them. For example, if you take something and you have some swelling in your mouth or your throat or shortness of breath, that might be an allergy, and you're not going to take the next one after that. So you should be in contact with your healthcare provider. And sometimes the side effects, there are certain side effects that are a little bit more serious than other side effects. So your pharmacist, when they fill your prescription, should go over this with you. And also you should have some information about when to contact that person who prescribed it for you. Always follow the instructions that are given to you when you're giving your medication. You need to know when, how much, how often, for how long, any special instructions, what to do if you miss a dose. So you want the instructions to be very clear. And if you don't understand something about them, make sure you ask the person who prescribed it for you or ask the pharmacist who's dispensing it for you. They might be able to give you a hand with that. And if you have any concerns about the medication or how it's making you feel or how you're reacting to it, make sure you talk to your healthcare provider before stopping that medication. Once it's ordered for you, the person who ordered it assumes that you're taking it as directed. Don't wait until a follow-up appointment a year later to tell them, no, you decided not to take it. It is important that they know if you've stopped it. Make sure you follow the treatment schedule. Different medications stay in your system for different amounts of time. That's why sometimes you take a pill once a day, and other times you might take a pill 4 times a day or even once a week, like the osteoporosis medications. They need to be timed appropriately because they stay in your system. Some of them are gone pretty quick and some of them stay in there for a very long time. It's also important to make sure that you finish the prescription as it's ordered by your healthcare provider. Sometimes if you don't finish it, things can come back. For instance, antibiotics, if you're prescribed antibiotics, you should always finish the course of treatment that your doctor, your nurse practitioner has prescribed for you. By stopping them, your infection can come back and can be even worse than it was before. So make sure that you follow the treatment schedule. Make sure you look at the timing of the medications. Sometimes medications work better if they're given with food, and sometimes they need to be all by themselves in your stomach to be absorbed. So you want to know whether they're better with or without food. Sometimes it doesn't matter, and your pharmacist can help you with that. An example, vitamin D, it's an over-the-counter medication, but it's fat soluble, so it's better absorbed with nice healthy fats with a meal. So take your vitamin D with a meal. And sometimes your body can only absorb so much at a time. So for calcium, for instance, if you've been prescribed calcium supplements that you're taking more than once a day, they need to be spread out because your body will only use so much of that calcium. You can't take it all at once. Never take medications that have been prescribed for someone else. Never share your medications with someone else. Don't take them if they're expired, for sure. And if they are expired or if you were discontinued before you finished using the whole amount that you have, take them back to your pharmacy or take them to your local hazardous waste disposal. You don't want to flush them down the toilet or put them in the sink or dispose of them where a pet or a child could get at them and potentially have some bad problems. So those are just some kind of general rules about any medication that you take. Why you should take them as prescribed is they're prescribed to either control a chronic condition or to treat a temporary condition and may cure it. Chronic conditions may never, ever be cured, but they can be controlled so that you live your best life. So to live your best life, if the medications can help you do that, take them how you're supposed to take them to make you feel better. If they're to treat temporary conditions, like we talked about an antibiotic, make sure you take them until you finish with them so that the infection is controlled or gone and you feel better. So taking them properly is to get the maximum benefit from them. And if you choose not to take them, or if you can't take them properly, there's lots of times no point in taking them at all. So that's why it's important. The instructions are there for a reason. They work in different ways and in different places in your body. And so they all come with different instructions. Otherwise, we could just, take them all at the same time, all at once at lunchtime and have it done with. So they don't work that well if you don't take them the right way. And sometimes how you take them and by following the instructions, you can prevent those unwanted side effects. We all worries about side effects, but you can't blame the medication if it's not taken properly. You have to make sure that, that you know the right way to do it. So now to get a little bit more specific for osteoporosis. When your healthcare provider decides that you need to be treated for osteoporosis, they want to do, or they should do, a comprehensive fracture risk assessment to determine your need for treatment. So Osteoporosis Canada guidelines have been released in 2023, some new guidelines, and they have specific recommendations around when medication should be given for you. So if you look, we'll start at the bottom of the screen. We know that after you've had a bone density test and your doctor or nurse practitioner has looked at all of the other clinical risk factors that you might have for osteoporosis, and your fracture risk comes back and it's less than 15%, there's pretty good evidence that says that you don't need to be on medication. It's hard to prevent something that's not likely to happen anyway. I'm not getting into how to interpret all the bone density score, but we use it, it's called a T-score, and we want your T-score to be higher than minus 2.5. So no treatment if your fracture risk is less than 15%. If your fracture risk is a little higher than that, so 15 to 19.9%, then there's a discussion that needs to happen between you and your healthcare provider, weighing the risks and the benefits of the medication. It's something, you know, you may benefit from some medication for a time, so it is something that you want to talk to your doctor or nurse practitioner about. And we know that if your fracture risk is over 20%, that there's a pretty good chance, 1 in 5 actually, that you'll come back and see us within the next few years with another osteoporosis break. And this is when that recommendation for treatment is the most important. And in this case, most often, the benefit of the medication will outweigh the risk of the medication. So it's important to have that discussion around all of your risk factors with your family doctor, nurse practitioner, so that they can help decide whether you should be taking the medication or not. So it's come back and it's recommended that you take medication to help prevent broken bones. Now what? There are options that you can talk about with your healthcare provider, and we're going to look at some of those. It is important to know that the medication for osteoporosis and all of the medications for osteoporosis have one purpose, and that purpose is to lower your risk of having broken bones. That's the only purpose that they have. So if it's recommended, that means that your fracture risk is high enough that you're at high risk to bring more broken bones. And we know that the medications work and they can lower your chance of another break by roughly 50%. There are other things that are important. Diet and exercise is very important in your treatment plan, and it's important to make sure that you follow those recommendations. But if your risk is high enough, sometimes diet and exercise are not enough to lower your risk of fracture, and those things need a little bit of help from the osteoporosis medication to help lower your chance of breaking a bone. So the other thing that's important, and I'm not going to get into a lot of this today either, is that it's important that your calcium level and your vitamin D level are nice and normal for you to take the medication. They're like tools that that pill or that med uses to help to lower your chances of a broken bone. So oftentimes your healthcare provider will do some blood work just to make sure that those levels are nice and normal prior to starting the medication. Always we recommend food first for calcium. So you need a little dairy in your diet to be able to get enough calcium. And almost always you need a supplement for vitamin D. This is individualized based on you. So what for the general population, there are recommendations around calcium and vitamin D. They might be different if you are on the medication for your bones. So that is something to definitely discuss with your healthcare provider. So the first choice, usually when we look at the osteoporosis meds, are the bisphosphonates. They lower the fracture risk, and they are the ones that we tend to go to first. They can be taken by mouth, and they can also be taken intravenously, which is directly into the vein through a small needle in your arm, usually. These medications have been around for many, many, many years and are safe to use. They work on the cells that break down bone in your body. So they slow down, they're called osteoclasts, and these medications work there to help slow them from breaking down bone or taking minerals out of your bone. They don't build a lot of new bone. So they're there to maintain your bone density. And they change the quality of the bone so that your bone is stronger because it's better quality, not because it's better quantity. Bone density measures quantity more than quality. So you want to understand that if your bone density isn't getting a whole lot better on the bisphosphonates, that's okay. We just don't want to see it get worse. So we want this to stabilize your bone density. But we know that while you're taking them, that the quality of the bone is better. I often say to my patients, it's kind of like if you have a pill that you need to break in half and it has a little score line down the middle of it. It's really easy to snap that pill and break it in half. If there's no score line down the middle of it, it can be very hard to break that pill in half. So what the medications do for your bones is they kind of fill in the little score lines so that they're harder to break and a little bit tougher. So bisphosphonates, first choice. If you take them orally or if you take them by mouth, it is very, very important that you take them correctly. They must be taken correctly or else they're not going to work. So usually they're given once per week, but they can be given daily, or even there is an option to take one a month. They must break your fast, so they must be the thing that you do first in the morning when you wake up. So they are always given very first thing in the morning. They must be taken with plain water. Plain water is important. A lot of times people have mineral water, but mineral water can contain calcium, and calcium can impact the absorption of the medication significantly. So just plain old tap water is what you should take them with. Not coffee, not tea, not juice. Coffee, in fact, if you take it with coffee, it'll lower its absorption by about 60%, and you won't get much bang for your buck from it. So it always has to go with water. The medications are not absorbed very well, so they need to go down into your stomach all by themselves with only water. The water washes them down into your stomach. As soon as you put other things in the stomach with them, the absorption stops, and you're not going to get the good use of them that you need for your bones to help to prevent your fractures from happening. They must be taken whole. These medications cannot be crushed. They cannot be chewed. They cannot be, smushed up in yogurt or pudding or anything like that. They have to make it from your mouth to your stomach without stopping in between. They are very safe in your stomach, but if they sit in your esophagus, the tube that goes from your mouth to your stomach, they can actually cause some damage there. So it is important that you get them down into your stomach. If you can't take them that way, or if you have trouble swallowing, or if you choke on your pills or anything like that, then you really need to look with your healthcare provider for a different option to treat your osteoporosis to prevent fractures. You must remain upright for at least 30 minutes and until after the first food of the day. Now, that's the general recommendation, is 30 minutes. I always tell my patients to wait at least 60 minutes before they have any other food or any other medications for the day. This allows that medication to stay in your stomach for as long as it can be, to make sure that the absorption is optimal so it can get into your bloodstream from there and get to your bones to do its job. So 30 minutes is good, 60 minutes is better. I have people say that, their doctor has told them that they have to stand still for an hour after they take the medication. This isn't so. The reason why you have to stay upright is to keep that medication in your stomach. Like I said, it's safe down in your stomach, not if it washes back up. So it's all about gravity. Sitting up or standing up is making sure that the medication stays down there. It doesn't mean you have to sit stark still. It doesn't mean that you have to stand stark still. You can go for a walk. You can have a shower. You can watch TV, read the paper. You just can't lie back down for that hour. And it's best not to until you've had your first food of the day, to help to make sure that that medication stays down there. You have to be careful with blister packs too. So blister packs are a very useful tool to help you to remember to take your medications in the right way. But the osteoporosis medications need to be taken alone. So you should talk to your pharmacist about holding them out of the blister, or at least identifying them in some way so that you know which ones they are and you're not taking them with a whole bunch of other morning pills. This is available on the Osteoporosis Canada website. I give this to all of my patients that I start on the bisphosphonates, the alendronate or the risedronate. So I give it to them so they can put it on the fridge and they can follow the instructions to a T. I usually put my phone number on the bottom too in case they have any questions. But this is available on the Osteoporosis Canada website that you could print yourself if you do take one of these medications. Potential side effects, the most common side effects are nausea, heartburn, upset stomach. It's the GI side effects. Those are the most common side effects that you hear about. Rarely I've seen people report constipation or excessive gas with them, but that's very, very uncommon. I have been doing this for a long time, and I have had 2 people in my practice get diarrhea from the medication, and we knew that they weren't going to be taking it after that first pill. So diarrhea is a potential side effect. And sometimes when you first start taking it, you can have achy bones. And those achy bones, if you can persevere, will generally go away if you can stay with the medication for a while. All of those side effects are nuisancey. They're not dangerous side effects. Okay, so, but the goal is never to make you feel more miserable. You have your best life to live, so you don't want to actually not feel good when you're taking the medication. So if you are having some of these side effects and they persist and they are really troublesome to your lifestyle, you should talk to your primary care provider about changing to another option. And just as there is no science behind this whatsoever. It's just observation from patients that I've worked with. I have seen it that if, the alendronate bothers your stomach, maybe the risedronate won't bother your stomach, and vice versa. Like I said, there's no science behind it, but we all react differently to medication. So sometimes just a switch between the pills can make a difference for you. The other option that I talked about, if you can't swallow the pills, is the IV infusion or the intravenous infusion. This is usually given in an outpatient clinic area, but it can also be given if you've had a fracture and you're in the hospital as an inpatient. So this medication is a bisphosphonate, just like the pills are. It goes directly into your bloodstream, though, so we avoid all of the upset stomach and GI side effects that you might have. You don't need to remember to take it once a week. It can be good for patients who have swallowing difficulties and can't tolerate the getting the meds down into your stomach. So this is usually given after you've had some blood work done to check your calcium levels to make sure that they're okay, and sometimes your vitamin D level. So it's important that your doctor knows that before they just prescribe it. And it's important that you keep yourself well hydrated on the day that you have your infusion. You should drink 2 cups of water before and 2 cups of water after. The best thing about these ones is that they are normally only given once a year. So sometimes it's even up to every 18 months. The medication stays in your system for a long time, and that way you avoid all the weekly bother of taking the pill. Okay, so that's an option as well. Potential side effects from the zoldronic acid or Aclasta, which is the medication, what the medication is called. About 30% of people will have flu-like symptoms. We call it an acute phase reaction after they have the infusion. So you can feel achy, tired, feverish, pretty miserable for a couple of days afterwards. You know, usually it's gone by a week at the most. It's 30% of people, 70% of people don't have that feeling at all. It's not an allergy. It's not a bad reaction to the drug. It's a Tylenol thing, not an antihistamine or an allergy pill thing. So it is important to know that. And most often, this only occurs after you have your first dose. So if you've had a reaction after the first dose, it's not as likely that you would have that reaction after the second dose. In very rare cases, there can be kidney dysfunction after you have the medication. That is extraordinarily rare, but that's why it's important to have your kidney function checked beforehand and to make sure you keep well hydrated on the day that you have the medication. And rarely it can lower your blood calcium level a bit, which is why we always want you to make sure you're getting enough calcium in your diet and make sure that you have some vitamin D in your diet to help to regulate that. But if you were to have tingling or numbness in your fingers or your toes or around your mouth, then that would be something that you would definitely want to talk to your doctor about. So zoldronic acid is a bisphosphonate. It lowers your chance of having another broken bone. Side effects are rare, and it's a great option for people, especially if there's swallowing difficulty or upset stomach with the pills. Denosumab is another medication that is commonly used for osteoporosis. It reduces your fracture risk by roughly 50%. It slows the breakdown of bone to make the quality of the bone stronger, just like the bisphosphonates do. It doesn't build a whole lot of new bones, so we're not expecting to see huge leaps in your bone density. Remember, it's about the quality of the bone more so than the quantity of the bone. Denosumab is administered usually with a needle in under the skin. And now there are some biosimilars that you may have heard about. A biosimilar medication is very similar to the original medicine. It's not exactly the same, but from a clinical perspective, they work as well. So there's not a significant difference in efficacy, which means how well they work, or in the safety profile of the medication. They are all very well tested before they come to market. So right now in Canada, Jubbonti is probably the most commonly used biosimilar medication. In Nova Scotia, where I am, it is anyway. There are different ones coming onto the market and already on the market as well. I know that you probably have heard that it's very important not to stop Prolia when you've started taking it. But denosumab, the generic name, Jubbonti is another option. So you can take that as well. This is often used for people who can't swallow medications or who can't take the bisphosphonates for some reason. It is sometimes used in nursing homes because we can be very sure that patients are going to get that medication every 6 months on schedule, because this one, it's really important that you have it as it's scheduled. Jubbonti or Prolia or denosumab should be stored in the refrigerator. This isn't one that you keep on the kitchen counter on the shelf. It can, however, be kept at room temperature for up to 30 days. So if you're traveling, you can keep it at room temperature, but it shouldn't go back in the fridge after those 30 days. This is given as a needle under the skin. It is important to have your calcium level checked before you have the denosumab, simply because it can cause you to have low calcium levels, just like the bisphosphonates can. And it's usually given by a trained healthcare provider, simply because it's only given every 6 months. So it's kind of hard to learn how to do something and then have to do it again 6 months later, and you've forgotten how to do it in the first place. So it is usually done in the healthcare provider's office. However, you can learn to do it yourself. I talked a lot of people through it over the phone during the pandemic, so they could have their dose and not miss it. The medications, depending on the manufacturer, the delivery method might be slightly different. So I'm not going to get into each and every one of, how to use each and every one of the devices to give the injection. But the syringes do come pre-filled. So the medication is already in the syringe, and the syringe is a one-time use, and it should be discarded after it's used in a sharps container. So potential side effects from the denosumab, very rarely. You don't see side effects too often. One of them is cellulitis, which is an infection in the skin. There is a very slight risk of increased risk of bladder infection, and there's a very small risk of developing eczema. If you're allergic to it, then of course you shouldn't take it, but you don't see allergies very often. With denosumab, like I've said, it's really important that you don't miss or delay a dose. So unlike the bisphosphonates, which we've already talked about, the denosumab doesn't bind to your bones for a long time, and it's gone from your body after about 7 months. And this can lead to a rapid loss of the good effects that it has on your bones, and really increase the risk of having spontaneous compression fractures in your back. So it's very important to maintain your schedule. And if you've been on it for a long time, this is always managed. If you need to come off of it, it should be managed by an osteoporosis specialist. Denosumab is not one of the medications that you can have drug holidays with. Teriparatide. Now, this one is a little bit different. Teriparatide is a medicine that stimulates the cells that build bone. So this is called an anabolic. It actually builds up your bone faster than your bone is lost. So the goal is to see improvement in your bone density and a reduction in your fracture risk. This one can only be given for 2 years currently. It's given by a needle that goes under your skin, and it's given once a day for those 2 years. And it's got to be followed up by one of the medications that we've already talked about to help slow the bone loss, because you don't want to lose the good improvements that you've had in your bone density after you stop it and it's not in your system anymore. It is very expensive, and it's not always covered by insurance plans. And sometimes it's covered under certain circumstances that is usually has to have a special form filled out by your healthcare provider to be able to have it covered by some of the government MSI programs that we have. In Nova Scotia, if this is the case, it would have to be ordered by an osteoporosis specialist. This one is reserved for people with very severe osteoporosis, especially those who've had spine fractures. It is for people who have been on bisphosphonates or other medications and have continued to fracture anyway. So it's a very strong one, and it's reserved for people, that, like I said, that have severe osteoporosis. It's not usually given to people who have had a history of radiation or cancer. This one should be stored in the refrigerator. It can come out of the refrigerator for a maximum of about 24 hours. If it's out for 24 hours, it should only be re-refrigerated once. And if you're going to travel with teriparatide, it's best that you have a cooler for it. So the most two brands are Forteo, and there's a Tiva teriparatide that I didn't write on here. Those are the two first brands, and then there's a biosimilar called Osnuvo, which similar to the denosumab that we talked about. It's not exactly the same as the original medication, but it's close enough that it has the same clinical actions. So they're very safe and can be given one instead or the other one. This one is administered daily, like I said, so you would learn to administer it yourself. It comes with a device. It looks kind of like a pen. And you're usually set up with somebody who will come in and teach you exactly how to give the medication so that you're giving it properly. And after you've completed it, like I mentioned, you would transition to another medication. This one isn't a single-use syringe, so you wouldn't throw it out. The medication is loaded inside of it. So you wouldn't throw it out until after I think it probably has actually, I'm not even sure. It might have a month's supply in the pen. It might be a little bit less than that. But your pharmacist can direct you with that. The potential side effects of this are fairly rare. There's mild dizziness, nausea, sometimes some joint pain or leg cramps. You want to contact your healthcare provider. This one is kind of the opposite. You can have higher calcium with it. So if you have if you're exceedingly thirsty or if you're vomiting or if you have confusion, this would be a time to talk to your healthcare provider. Or if you've started taking it and you've had continuous nausea, constipation, low energy or muscle weakness, that might be something that you want to make sure that you talk to the person who prescribed it for you about to see if it's working okay for you. Like I said, most people never want to make you feel worse. We always want to make you feel better. Romosozumab is the new kid on the block. The brand name of this is Evenity. This is also a needle that goes under the skin. This one actually works a little bit differently because it works both to prevent bone loss, like the bisphosphonates and denosumab do, and also to promote building of new bone. So this one works both ways. So it is very good, and it does really reduce the risk of fractures. You take it for a year, and then it will be switched to something like a bisphosphonate to prevent any loss of that new bone that you've built up. This should be stored in the refrigerator, and it's safe out of the refrigerator for about 30 days. Once it reaches room temperature, it should not go back in the fridge. This one is given under the skin, subcutaneously, so it's like a needle under the skin. You'll get 2 injections once a month for 1 year. So we know that it works really well for a year. The 2 injections are given at the same time. So they're 2 exactly the same pre-filled syringes that go underneath your skin. The dose is divided into 2 so that it can be best absorbed under your skin. And you will be taught how to give this medication. And if you're unable to give it yourself, then perhaps a family member might be able to help you out with that. These the injections are given one after another, usually in 2 different spots on your body. Okay, and you'll learn to give it yourself. Most common side effect, again, is lower blood calcium. Sometimes people get colds with it, joint pain or back pain. There is a slight increase in the risk of cardiovascular events. So your doctor will ask you about that before it's ever prescribed. And it's always a measure of the risk versus the benefit. This one is also very expensive, and it's often not covered by the provincial plans. And you would have to have a special form filled out to be able to have it paid for. And it also works the very best if you've never been on osteoporosis medications before. So you want to take this one the first time, if you have severe osteoporosis, it would be the first one that you take. Yeah, so those are the options of osteoporosis medications. I didn't get into detail about how to give the injections because, like I said, all the devices are different, but they all go under the skin. So it doesn't, it's a little bit less. It's not even like getting a vaccine, which goes into your muscle. So most times people don't have any trouble with it. It's almost like an insulin needle. So if you're having to give yourself an injection, the most common sites would be your thighs, your stomach, or your upper arms. If you're using your stomach, you're not within 2 inches of your belly button, so you want to stay away from that area. And if you're using your arms, you'll probably need assistance with it. So first thing, wash your hands. Make sure you check the expiry date on the medication that you're using. It's always more comfortable to inject it if you let it come in, if you leave it out of the fridge for a few minutes before you inject it. Clean your site, usually with an alcohol swab. Avoid areas that are bruised or red or scaly or sore. Pinch the skin up at the site and insert your needle at 45 to 90 degrees. They all have a little bit different recommendations, so that's why I put the range in there. Depress the plunger as far as it will go. Leave it for a few seconds. Remove it from your skin and put a little cotton ball on the site. You don't need to rub it after you give the injection. And if sometimes people bleed a little bit, most times not, but you might need a little Band-Aid over it. And then the syringe gets disposed of in the sharps container, or in the case of the teriparatide, you put it back in the fridge for the next time. So that's just a really quick and dirty. I don't want to get into detail because you should be taught the proper way to do it by your provider anyway. A lot of people wonder what happens if they miss a dose. So if you're taking the pills for your bones, you want to take it the next day. So if Saturday's your day, you forget, you get up, you have your coffee. Don't take it later in the day on Saturday. Take it Sunday, and then the next week you can go back to Saturday. It's more important to take it the right way. If you're on denosumab and you've missed your every 6-month dose, it is really important to get that as soon as possible. So you want to contact your healthcare provider and make an appointment to make sure that you can get that. If it is the IV infusion, it's once a year, so you're a little bit more flexible with that one. So it should be a discussion with your doctor or your healthcare provider to schedule. Teriparatide, if you're taking that daily and you've forgotten to take it as soon as possible on that day, but don't take 2 doses in the same day. And the romosozumab, schedule your next dose. If this one is once a month, so you want to schedule your next dose as soon as possible, and then work every month from the date of that dose. So everybody forgets once in a while, but it is important to manage that in the best way that you can. And how do you know if your medication is working? This is the hardest part about the osteoporosis medications. You can do everything right, and I can't reward you and tell you that your medication is working, because it does not make you feel better. It doesn't make you taller. It doesn't make you prettier. It's not going to do any of those things. You know it's working because you haven't broken any more bones, and you know it's working if your bone density remains stable. Like I said, for the most part, we don't expect to see a big improvement in your bone density. They're not going to prevent you from falling, but they might prevent the break that happens from the fall. So that's how we know that your medication is working, that you don't break. But we also know that osteoporosis doesn't hurt. It's the fractures that hurt. So that's what we're really trying to prevent, is the hurt from the fractures. Please don't test the medications by trying to fall. If you fall and break, you don't break and fall. So it's important to prevent falls as well. Some people stop taking their medications because they have memory issues, or they've forgotten about them, how to take them, because they feel better. So, you know, especially even with blood pressure medications. Oh, I feel better after I've been on my blood pressure medication, so I don't think I need it anymore. Well, you need it because that's what's making you feel better. So it's important not just to stop because there are no symptoms. Sometimes the side effects are pretty harsh. So if you do have side effects that are bothering you, it's important to talk to your doctor, your prescriber about that. Some people have uncertainty about the benefit of the medication or treatment or prefer a natural approach. With the osteoporosis medications, the natural part is very important, but sometimes the medication has to be partnered with that. So I think that both things actually come into play there. Sometimes people don't communicate well. Sometimes it's poor communication between you and your provider, so about the importance of the medication. Sometimes the cost is prohibitive, so if people can't afford it, it's very hard. And there are some pretty intense instructions with these medications, and sometimes that's hard to follow. And if you're on a whole lot of different medications, sometimes people don't want to take them because of that potential complicated treatment and the scheduling of everything. So what if you just decide to stop taking your medication? I've heard so many times. I have a friend who said that they took this medication. It was terrible. It is important to know that everybody does respond differently to the medications. And it's really important to listen to the person who has the education and the background to be able to provide you with accurate information about how the medications work and what they're supposed to do. So I'm sure that there are lots and lots of people out there who had side effects from the medication and it bothered them. But I'm also sure that there are many, 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 many more people out there who've never had side effects. So your body and your friend's body would be certainly very different. The other one I hear is I've read it on the internet. Well, Dr. Google, just because it's written down doesn't mean that it's true. So you have to be very careful about where you're getting your information from on the internet. And a lot of times people say, well, I'm too old anyway. Well, the older you are, the medication probably works better because you might be at higher risk to break and you might get more bang for your buck. So it's always important to talk to your healthcare provider. They're the ones with the background who can help you to decide about courses of treatment. So it is important to help them. And the reason why people do tend to stop is because of the two very rare side effects from the osteoporosis medications. I think they are the most talked about side effects that happen the least amount of the time. They are scary, so let's be realistic. One of them is called osteonecrosis of the jaw. What that means is if you've had damage to your jawbone, damage usually because a tooth has been pulled out or an implant has been drilled into your bone, sometimes its ability to heal is impaired. The chance of this happening is very, very, very rare. It comes after the damage to the bone, and it's not from a cleaning or a filling or a root canal. So very, very rare that happens, and good oral hygiene is important to help prevent this and to tell your dentist if you do happen to be on it. The other rare but serious side effect to the medication is called an atypical femur fracture. An atypical femur fracture, AFF, is a fracture that can happen in your thigh bone. It starts as a little crack on the outside of the bone, and it can spread across the bone, sort of like a crack in a windshield in your car. We make all the bones stronger, and sometimes the thigh bone can get a little bit too strong. This bone can break. It's a terrible side effect. It is unusual, but it's there. It usually comes with some pain in your thigh or in your groin, especially with weight bearing. So you should tell your doctor about it because they can do x-rays and see that oftentimes before it happens. This fracture happens lower in your leg than a regular hip fracture would. So those are the side effects, and they're scary. And when I tell my patients about them, I really feel like I'm scaring them more than I need to be. So I want to show you this. This is a tool that's on the Osteoporosis Canada website, and it kind of shows you the chances of these breaks happening. So if you look at the orange line, Okay, I think if you look over here at the orange line, if you're at high risk of having a broken bone from osteoporosis, this is kind of a demonstration of your risk. This is a demonstration of you having that rare side effect called osteonecrosis of the jaw. So you're actually more likely to be murdered than you are to have this side effect. And it often happens in patients who are on the medication at a much higher dose than we use for osteoporosis and have been on it for a long time. So that's a very, very rare side effect. And you can see that the benefit of the medication, we can lower your risk in half, right? The benefit of the medication far outweighs the risk. The same thing with your the femur fracture that we talked about. The benefit of this is your chance of having that femur fracture at 2 years. So the benefit of the medication, again, it far outweighs the risk. But the medications, if you're on it for a very, very long time, that risk does go up a little bit. So oftentimes we do recommend a little holiday or a break from the medication. So many people are actually more worried about the side effects than having a new broken bone. But you know, a broken hip can be fatal, right? You don't want to have that. So it's always worth a discussion with your provider about the risks and the benefits of the medication. So, can you have a break from it? The recommendation is yes. So if you're on the medication for a while, you come off of it, and it allows that risk of those side effects to go down. So Osteoporosis Canada recommends that you stay on the medication for 3 to 6 years and then have it reassessed. 6 years, probably a little longer if you've had the more serious fractures like a hip fracture or a vertebral fracture, have had multiple fractures. So you can have a break from it for a while and have your fracture risk reassessed and see if you need to go back on it after a few years. That break would be shortened if you've had a change in your health status that you might be at higher risk for fracture. It's always looking at the risk and the benefit. Sometimes people are at such high risk of breaking a bone that coming off of the medication because of the potential for the side effects is probably a higher risk than staying on the medication is. So it's always worth a talk to your family doctor. The only medication that you can have a holiday from are the bisphosphonates. So that's your pill, your alendronate or your risedronate, or your zoledronic acid, the IV infusion. We've already talked about the fact that denosumab is for long-term therapy. When you go on that, that's forever. And to come off of it, you really need to work with an osteoporosis specialist. The new kid, romosozumab, you get for a year and then would transition to probably a bisphosphonate. And the teriparatide, you're on for 2 years and then would transition to a bisphosphonate. So just to wrap up, and I know I've taken up almost all the time, make sure you understand why you are taking the medications, how to take the medications, and make sure you take them correctly, know the expected side effects, and know what to do if you are too uncomfortable with the medication to continue with it. So talk to your doctor. Always discuss with your care provider about changing or stopping any medication that they prescribed. Remember, they're assuming that you're taking it when they've prescribed it for you and you've left the office. Osteoporosis medications are safe and significantly lower your risk of having another broken bone, but they need to be taken correctly. And the benefit of the medication, if you are at high risk for fracture, outweighs the risks of the medication. And if you have any questions and concerns, it's always better to direct them to your care provider, not Dr. Google. You want to talk to somebody who really has had training and knows what they're talking about. So that's all I have to say. I know that was pretty quick. I don't know, Tracie, if there are any questions or if we have time.
Yes, no, that was amazing. We do have time only for one or two more questions, or one or two questions. The first one is, and you did talk about it, how much wiggle room is there for safely delaying an injection for denosumab, which is Prolia or the biosimilar equivalent? Is it something where it has to be exact on the day and the time, or do people have a bit of flexibility?
Well, there is a little bit of flexibility with it, but I would say that it's probably not months. It would be, within weeks. Remember, I said that the medication is gone by 7 weeks. So if you did miss a dose, you want to follow up with your family, your care provider as soon as possible to make sure that you get that dose to make sure that you're not at risk for side effects.
Okay, great. And we did get a couple of questions on people who travel. So, and not just travel within the country, but when you travel outside of the country, are you able to work with your healthcare provider depending on the type of medication you're on to see about, again, flexibility in terms of the schedule or how to travel with the prescription? What would you suggest?
So it's always good to plan things carefully. When you do travel, it is possible to carry the medications with you. They should be kept in their original container with your original prescription label on them so that when you go through the airport, if you get stopped, they can look at them. The some of the medications, teriparatide, for instance, if you can travel with a cooler or an ice pack to make sure that you're keeping them chilled. They do have a little bit of time to allow for travel so that you can put them in a refrigerator when you get there. So it is certainly possible to travel with the medications. Like I said, with the denosumab, usually given in a healthcare provider's office, but you can learn to give it yourself. So those things can be done. There is a great if you Google, there is, as I talk about Dr. Google, there is the Government of Canada has a great website about traveling with medications, and they will have some tips there too. Most important thing is always put it in your carry-on luggage, never put it in your checked baggage, because if that gets lost, you're without your medication. So yeah, you can travel with it. You just have to make sure that you're following the storage suggestions or recommendations as closely as possible.
That's wonderful. And I know we've had other questions. We have run out of time. We do have to unfortunately end this wonderful presentation. Carla, thank you so much. That was so informative. Um, we do have lots of other information on the website. So there are other replays. This was recorded. It will be sent out by the end of tomorrow, so that, if you want to rewatch this, you can go ahead and do that. If you're trying to track your nutrient intake, you can also download the nutrient calculator. And we do have a new podcast that was just launched a couple of weeks ago about fall prevention strategies, all available at osteoporosis.ca. And coming up, it's not yet set up. We have a 4-week series on modifying summer activities and sports that are coming up, cooking demos with Emily Richards. And just check your email, check the website. You can also find us on Instagram, Facebook, YouTube Music, and LinkedIn. Thank you, Carla. That was really wonderful. Thank you to everyone who joined us. And have a great rest of your day, everyone. Be well. Take care. Bye bye.
Thanks, now.